My last position was as treasurer the last 17 years. I started in 1967, retired in 2002 with a total of 35 years at catering.
As the treasurer?
I started as an accountant, chief accountant, assistant treasurer, and treasurer when I retired. We have a friend who worked here at catering at that time as a dietitian. December of 1966, she called and said, "What are you doing in Chicago?" You know, my wife, Adela, is a dietitian. She said, "We need Adventist dietitians to come to catering." And she said, "We will go up, give you some pictures, tell you some stories about this new hospital at catering. And if you are interested, maybe we can get together and invite you to come and see the place." So December of 1966, Mr. Wall, the director of nutritional services, and this dietitian, Miss Royalyn Case, came up to Chicago. We went to a Chinese restaurant with 3 other Adventist dietitians in Chicago. So they gave us the show and tell about catering. We saw the nice pictures, the nice surroundings, the nice homes around the hospital. And they told us about the people they're recruiting from all over the place. And they said, "If you are interested, why don't you come down and see the place yourself and see you might be interested." So February of 1967, we came down. It was winter. We stayed at this friend's house, and Adela and me, we saw the hospital, gave us a tour. It was just like what was in the picture. We saw the place, the surroundings were, of course, snow-covered, but they were nice. The inside was better yet, very clean. And of course, we were working at hospitals in Chicago also, and nothing like that, nothing like catering. So my wife and I said, "Why don't we consider this place? This is a better place to raise children than in the asphalt jungle of Chicago." So she was given an interview. I asked Mr. Wall, the director, I said, "You have a job for my wife. What do you want me to do? I don't have anything. I cannot be at home and be a mom." At that time, we have a 6-year-old and a 15-month-old boys, 2 boys. He said, "Don't worry, we'll have something for you. Maybe a cashier at the cafeteria." I said, "Cashier at the cafeteria? I'm chief accountant here at St. Joseph Hospital." Anyway, he arranged for an interview for me with Mr. Reichard. He was the controller at the time. So Mr. Reichard graciously gave me an interview, knowing that there was no opening, no job available in the business office. Anyway, we had an interview. He asked me what I know, what I can do. I said at St. Joseph Hospital, this was 1966, if you recall, July 1, 1966, Medicare was inaugurated. That was the beginning of Medicare. And we're talking of February 1967, close to the first anniversary of Medicare. But 2 years before that, at St. Joseph Hospital, where I was working, they sent me to all the seminars that I could find about Medicare, learn about billing, reimbursement, everything about Medicare. So I have been attending all kinds of meetings. So I told Mr. Reichard, I have been in hospital field for quite some time, and I've studied Medicare for so much. And he said, "Oh, I wish you could be part of our team here." So we left it at that. We went home to Chicago. 3 weeks later, I got a call. Mr. Reichert said, "Our chief accountant just accepted a call to go to Boulder, Colorado as chief accountant over there, and I need you now. Can you come right away?" I said, "Mr. Reichert, at least I need 2 weeks to tell the sisters that I'll be leaving." See, they invested a lot in me for this Medicare program, and I'm sure they'll be disappointed. So I braced myself how to talk to the sisters. So I came one day and said, "Sister, I have a call to go to Kettering. It's a Seventh-day Adventist institution. And you know I am a Seventh-day Adventist." I said, "This is just like one of you. You are in one convent. When the Mother Superior calls for you to go to another convent, you do not question why. You just do it and just follow." I said, "I feel the same way, that I'm being called to Kettering, one of our institutions. So if you don't mind, I like to go, and I'll give you 2 weeks." She said, "Well, I cannot argue with you. You'll have my blessing. You can go." So in 2 weeks, I was here. I started alone. They put me in the guest room at the girls' dorm, gave me a meal ticket, the cafeteria, and I started working. While my wife was packing in Chicago. So after 3 weeks, the truck of the hospital, the driver and I went to Chicago, pick up our things, and we all came down here. And that was the starting point of our career at Kettering, 1967 to 2002. I have not met Mr. Nelson yet at the time, but later on, we had some interaction because I was at the finance office, and of course, Mr. Nelson used to come in and got to know him better, and we talked. And I was really impressed. I found Mr. Nelson to be very perceptive and a really wise man. I found him to be forward-looking. He can see the total picture and yet still mindful of some of the details. He really had a full grasp of the situation. He knew where the organization or the medical center was supposed to go.
Have a chance to meet Virginia Kettering or Eugene Kettering?
No, I just heard of them, about their good work at Hinsdale, where the impression was to build Kettering here in Dayton. But what I learned about them was that in spite of their status in society, they are still close in common touch with the common man. They are not very demanding, or they're just like any one of us, which is really impressive. Well, of course, Mr. Nelson always expound on that one. He was saying, we want this hospital to be top, first class in all its ways, in nursing care, ancillary services, even the food service, and the surroundings and the environment. We want this to be the cleanest hospital. And that came through. We saw that. I saw that. our first housekeeper, oh, Mrs. Chase, Mildred Chase, I remember her. She was, she really carried it out. No food in any department, which was good.
Do that make
Well,
it unique?
Mrs. Chase saw to it that the hallways are clean, even up to the kitchen. And then, of course, she would go and inspect the different areas, the laboratories, the X-ray, rehab, all the other areas. So when you come into the hospital, our impression anyway, when we came in, when we first saw the hospital, at the lobby, we said, this is not a hospital, this is just like a hotel, first-class hotel. And that was the impression that we took. So that wherever we went, we said, well, we work at the Catering Hilton. Well, we have a global mission. We have healthcare. Of course, the healthcare in the United States divided into several areas, several territories. But at that time, Catering started the healthcare organization. It was during the time of Dr. Schaffner and Mr. Willett was vice president then. They said, Nemi, let us start this organization. We will take all the executives, make a separate organization for it. You take care of the payroll and the benefits of this group. That was the beginning of NEMA. After several years, NEMA was formed and they took our little corporation at Catering, included with NEMA.
And tell us what NEMO is.
NEMA is the healthcare organization for the Midwest, northeastern Middle America. And of course, after the intent of NEMA was to supervise all the hospitals. We have Hinsdale and Shawnee, Catering being the biggest, and some of the other small ones. They would like to have the organization that the specialists or the specialties of the different hospital can be used in the smaller hospital to benefit them. But the specialists were mostly at Catering. So that did not last long. We found out that it's cheaper to be independent alone than be part of the total program to pay all those fees. So that began the demise of NEMA. NEMA was originated at Catering. See, we maintained our high standards at Catering. And we probably influenced NEMA as a whole from Catering rather than them influencing us. Well, the spiritual aspect and the culture of Adventist healthcare has permeated the organization. Of course, we have that from the beginning. You know, Mr. Nelson had that foresight, and we carried that through all through the years until now. Oh, there were many. Of course, there was Mr. Nelson and Dr. Schaffner, Bob Willett, Dr. Bevan. Those were the patriarchs at that time. And then, of course, there were younger ones. Of course, the financial people, I worked with Ken Bauer and Bob Hendershot, Kevin Lang. They're all good, bright persons. So I learned a lot from them. And of course, the church too. Yes, I would say that There are three hallmarks of catering from the beginning. First one is good patient care. Patient care meaning not only medical, which included the spiritual. That's why we have the church across the street. We have the employees get charged on weekends so they can provide good health care, top nursing care, ancillary services care. That's the foremost. And then we have selection of people. They are very particular at who they hire, from the top administrators, department heads, and employees. And the other hallmark is high tech. We have been blessed with acquiring quite unique equipment. They were very costly, but in the end, most of them paid off. And we were noted for that. High-tech hospital, good care, and good people.
Or fulfilling to you?
Well, for me, one of my earliest recollection was with Mr. Nelson. We have been here, we came in 67. About 1968, we were invited to go to Hialeah. So I went to Mr. Nelson and said, Mr. Nelson, we have an invitation to go to Hialeah. What do you think? He looked me in the eye and said, Nemi, we need you here. You're not going anywhere. So I just say, well, thank you, Mr. Nelson. And that was the end of that. At my next check, I saw $100 increase. Boy, I didn't expect that. But, you know, Mr. Nelson, he is very generous. So. And of course, the other person that really probably say a good word for me here at catering was Dr. Hedrick. Dr. Hedrick and I worked at Manila Sanitarium in Hospital for several years. He was medical director. I was in the finance office. I used to write checks, bring it to his office, and he would sign it. And we had an invitation to come to America, so I went to Dr. Hedrick. I said, Dr. Hedrick, we have an invitation to come to America. Would you give me a 4 months leave of absence so we can just see the place? He told me, Nemi, you're not coming back when you go. That was prophetic. We never came back. We stayed here. It has been 50 years, but we have gone home to visit 4 times out of those 50 years.
So Dr. Hedrick, you met in the Philippines?
In the Philippines. We worked together
You
for
worked
several
together.
years.
Okay, and then you
And,
both ended up here.
That's right. After the Philippines, Dr. Hedrick came back, and it was at Kettering where he became the head of medical education. And when we came to Kettering for interview, they asked, do you know anybody here? We said, no, we just Dr. Hedrick. And I'm sure he put a good word for me, even though I left and did not come back.
You knew you weren't coming back. What about Dr. Schaffner? Did you work closely with him?
Oh yeah, well, you know, Dr. Schaffner for all his time. We were together. Nice man, very religious person.
You could just remember.
Well, he was very kind, but I would say that for me and the group at the finance office with Mr. Reichard, we did the first Medicare cost report, the first budget for the hospital, and from then on it went into several transitions, but we started that. It was good. We used to work together and discuss things, and of course with Mr. Willett, I enjoyed negotiating with Blue Cross with Mr. Willett. We had that several times, and also negotiating with the doctors.
You enjoyed that.
I enjoyed that. Well, of course, I learned a lot from Mr. Willett. He taught me a lot.
So you actually helped create the very first budget.
Very first budget, filed the very first Medicare cost report. And we were required to do that year after year, every year. And then face the Medicare auditors. At that time, we have 3 auditors. We have the independent auditor, we have the union auditor, and we have the Medicare auditors. And the union auditor at the time was the father of Mr. Willett. Oh, I had a nice time with old Mr. Willett.
Senior Mr.
Senior Mr. Willett. Nice man, nice man.
Might explain what the union was as opposed to the union, meaning the church.
Oh,
Yeah, that's a good point.
the union is composed of several conferences. It is a territorial district. The United States is divided into 9 unions and 1 union in Canada
Of the Seventh-day
of the Seventh-day Adventist
We're going
Church.
to start from the top and include Seventh-day Adventists. The United States is,
Okay, let's start from the top. The very top organization of the Seventh-day Adventists is the General Conference. That is the worldwide Seventh-day Adventist Church. Below the General Conference, they call it the division. So there is the North American division, which includes the United States and Canada. There is Inter-American division. There is the South American division. There is European division. There's the Russian and several. There are, I think, 11 divisions. In North America and Canada, there are 10 unions. See, that's the division of North American division composed of 10 unions. Columbia Union, which is our territory, is composed of, 7 or 8 conferences. We have Ohio and Pennsylvania and some of the others. The union is composed of several conferences, and of course conferences. A conference is a conglomeration of churches. So you have churches in one conference, several conferences in one union.
within the Adventist Church.
Within the Adventist Church.
Great.
Yeah, that's the hierarchical. We started with 400 beds.
Okay.
That's a big hospital. The financing of the medical center was augmented by borrowing money, by issuing bonds. We issued municipal bonds through Montgomery County, which allows us to buy equipment, do some expansion, and because of reimbursement and Medicare and private insurance, we were able to recover some of those investments and also provide some gains that we have to use and plow back and buy more equipment. When the hospital started, it slowly built up little by little. And then there was a spurt that patients come, and we experience full occupancy for some period of time in such a way that there are no beds available. Patients will come through emergency room, and some of them will have to stay there for some period in order to have some beds upstairs or in the wards to open up. Those were good times, because when you have high occupancy, there are some gains. And of course, some of those gains we invested, and we were blessed by those investments. We started with very, very meager amounts. I remember Bob Hendershot and I were talking. We said, oh, I wish we could have $10 million as reserve money, as nest egg. That will help us a lot. That came true, and today it's really very comfortable to have the nest egg that we have. It is, it's a comfort, and it's easier to manage when you have some resources. Oh yes, that was built up through the years. When the economy grows, well, the investments grow.
Was that kind of established early on with Mr. Reichard, Mr. Nelson?
Well, we started that with Mr. Nelson. I remember, I think it was, I don't know, $500,000 we started. And it grew and grew and grew. We added some of the gains through the years we added. And then some gains and income from those investments were all plowed back, and it grew. And that was, that's what we have now. High tech attracted more patients. More patients provide more reimbursement. More reimbursement provided more bottom line. So it was all beneficial for the medical center. You see, when they see Mr. Willett, that's what they see. But they don't know him as a man. He is very generous, very caring. Well, I knew it because his sons, or one of his sons, Jesse and my son, were in the same class in high school. So we would go camping together, and that's where, I knew him.